Poliomyelitis is a viral disease which is spread by fecal-oral or oral-to-oral transmission, insanitary disposal of excreta, and use of unsafe drinking water contribute to the spread. And the disease is characterized by varying degrees of acute flaccid paralysis, which commonly persists. And paralysis commonly affects one lower limb, but any group of skeletal muscles, including the muscles of respiration and bulbar cells in the brain, may be affected. Poliomyelitis is commonly acquired in childhood, and the infection is often subclinical and may only appear as a mild flu-like illness. Only few cases progress to develop paralysis. However, injections during periods of the febrile illness are associated with an increased incidence of paralytic poliomyelitis. Poliomyelitis is preventable by immunization, and prevention is almost certain if 4 doses of oral polio vaccine are given, as in the EPI schedule, as an expanded program for immunization. Rarely, vaccine-associated paralytic poliomyelitis may occur in recipients of the oral polio vaccines and their unimmunized contacts. And this is usually associated with the poliovirus type 2. Okay, so the causes are poliovirus serotypes 1, 2, or 3. And the symptoms are fever, headache, sore throat, muscle pain, flaccid paralysis. And the signs that are usually elicited are acute flaccid paralysis of affected muscles, diminished or absent muscle flexes. Investigations are 2 fresh stool samples taken 24 to 48 hours apart, and these need to be sent on ice to the appropriate regional public health reference lab for confirmation. The treatment objectives are to provide supportive care till patient recovers from acute illness, and also to avoid or limit the extent of paralysis, and to provide rehabilitation in paralytic cases. Non-pharmacological treatments include bed rest, avoid injections during febrile illness in children, physiotherapy, provision of appropriate appliances to aid mobility. Pharmacological treatment is non-specific antiviral treatment, and the referral criteria: refer all patients with difficulty in breathing and swallowing for hospital admission.